This is a rapid review of concepts commonly tested on the family medicine shelf. If you want to test your knowledge and secure extra points on your shelf exam, then please be sure to watch this video until the end. If you like this type of content, please be sure to put up the like button, hit subscribe, and that notification bell. So let's begin. What nerve innervates the muscle being tested? The suprascapular nerve. So this image is illustrating the MTCAN test, which is used to test the supraspinatus, which is a rotator cuff muscle. So knowing the rotator cuff muscle injuries or tears are very high yield. Recall that the supraspinatus is a rotator cuff muscle that is responsible for the first 15 degrees of arm AB or abduction. This muscle is also the most common cause of rotator cuff injury, so it's very important that you know this one very well. A patient who has been a vegan for 7 years has been taking B12 vitamins. What other supplements should the patient take? Vitamin D and calcium. So knowing what supplements patients should take if they are postmenopausal, vegan, or taking medications that would cause them to need additional supplements is also another high-yield concept. A newborn failed the otoacoustic emissions test. What is the next best step? Auditory brainstem response. A patient has been receiving total parenteral nutrition for 8 months. They now present with nausea, vomiting, and right upper quadrant pain. An abdominal ultrasound reveals gallstones. What led to the development of these stones? Decreased cholecystokinin release due to a lack of enteral stimulation. Is a disaccharide or monosaccharide used in the treatment of cirrhosis? A disaccharide. Recall that lactulose is used in the treatment of cirrhosis. What is the treatment of choice of a patient with a flask-shaped ulcer on histology? Metronidazole. You can also use other drugs such as paromomycin for the treatment of cysts. So whenever you see flask-shaped ulcers on histology, you have to think of Entamoeba histolytica. So let's say that a patient being treated for this infection develops nausea, vomiting, flushing, headache, and dizziness. What is the most likely cause of these new onsets of symptoms? And that would be a disulfiram-like drug reaction. Recall that if you are taking metronidazole and then the patient has alcohol, it can cause a disulfiram-like drug reaction, which results in the nausea, vomiting, headaches, flushing, and possible dizziness or abdominal discomfort. What is useful in detecting residual disease and recurrence of colon cancer? CEA levels. So knowing tumor markers is another high-yield concept. For example, if you have elevated CA19-9, you'd think of a pancreatic cancer. Or an elevation of beta-HCG could be due to a choriocarcinoma. What condition can aspirin prevent in pregnant women? Preeclampsia. What screening test should a 71-year-old male with a 40-pack-year history of smoking undergo? So this patient needs 2 screening tests. One would be an abdominal duplex ultrasound to assess for a AAA and a low-dose CT scan to assess for lung cancer. So really learning the USPTF guidelines is crucial for family medicine, which of course is all about screening and prevention of diseases. A patient with HIV was started on new antiretroviral treatment. They develop epigastric pain that radiates to the back and nausea and vomiting. What medication is the most likely cause of these symptoms? So if you have watched my video on HIV antiretroviral treatments, then you definitely know the answer to this, and it is didanosine. What test is most sensitive for screening for malabsorptive disorders? A Sudan 3 stain. This checks for fat malabsorption. What part of the GI tract is biopsied for evaluation of celiac disease? The duodenum. So recall that the most accurate test for celiac disease is doing a biopsy of the duodenum. And to treat these patients, you just need to do diet modification. What is this test called and what structure is it assessing? This is the anterior drawer of the ankle, and it is assessing the anterior talofibular ligament. So recall that this ligament is most commonly injured in an ankle sprain. It occurs when there is over-inversion of the ankle. What antibodies may be elevated in a patient with crypt hyperplasia, villus atrophy, and lymphocyte infiltration? IgA anti-endomysial and anti-tissue transglutaminase antibodies would be elevated. So recall that this is describing once a duodenal biopsy is done and the patient has celiac disease. So you would see the crypt hyperplasia, villus atrophy, and lymphocyte infiltration. A patient develops profuse diarrhea due to a bacteria with a cytotoxin and enterotoxin. What is the treatment of choice? Oral vancomycin. So the toxins described here are toxin A, which is a enterotoxin, and toxin B, which is a cytotoxin. These toxins are produced by Clostridium difficile. At what age is mammography screening stopped in a patient who has never had an abnormal result? 74 years old. That's when they will do their last mammogram. The presence of which clinical findings would require an ankle X-ray? Inability to bear weight, tenderness at the lateral malleolus, and tenderness at the medial malleolus. So this question expects you to know the Ottawa rules. So knowing the Ottawa rules of the ankle, the knee, basically all of them are extremely high yield. And it's also important to know the exceptions to this rule as well. For example, if a patient has extensive swelling that prevents you from being able to palpate the lateral or medial malleolus, a 62-year-old patient completes the get up and to go test in 32 seconds. What does this mean? The patient is at an increased risk of falls. So remember that you can assess a patient's fall risk by assessing their history of falls, their history of any mobility issues, their age, polypharmacy, and of course the get up and go test. What statins would be best to lower LDL by more than 50%? 40 to 80 milligrams of atorvastatin or 20 to 40 milligrams of rosuvastatin. So knowing high, medium, and low intensity statins is another high-yield concept. So you can also quarter these doses to convert them to a medium intensity statins. For example, atorvastatin is a high-intensity statin when its dose is 40 to 80 milligrams. However, at 10 milligrams of atorvastatin, then it will be considered a medium-intensity statin. What statins are classified as low intensity? 10 milligrams of pravastatin or lovastatin. What is the treatment of choice of asymptomatic bacteriuria? Nitrofurantoin. A patient develops profuse diarrhea due to a gram-negative curved rod that grows in an alkaline media. What food did the patient most likely consume? Seafood. So the gram-negative curved rod that grows in an alkaline media is describing Vibrio cholerae, and an infection with this bacteria typically occurs after consumption of seafood. And speaking of seafood, recall that in the United States, the most common way of a patient getting hepatitis A is by having raw shellfish. What is the treatment of choice of a patient with a vaginal pH greater than 4.7, a fishy odor, and thin homogeneous discharge? Metronidazole or clindamycin. So in this question, it is describing 3 of the 4 criteria listed in Amso's criteria, and this is used for bacterial vaginosis. And again, if you have a question that states a patient is being treated for BV and they develop dizziness, headaches, or even faint, you can think of a disulfiram-like reaction that occurred because the patient consumed alcohol. What antihypertensive medications are best for all races with chronic kidney disease? ACE inhibitors or ARBs? What antihypertensive meds are best for African American patients without chronic kidney disease? Thiazides or calcium channel blockers? What is the strongest risk factor for osteoarthritis? Obesity. What is the most likely diagnosis of a patient with hypertension, obesity, and nighttime awakenings? Sleep apnea. So hypertension is an extremely high-yield topic for family medicine. You have to master the antihypertensive medications, their side effects, their mechanisms of actions, what groups are they good for or not good for, and also the different presentations of hypertension, mainly the secondary causes of hypertension. For example, if a patient presents with hypertension and palpitations, you can think of like pheochromocytoma. And if a patient presents with hypertension, increased abdominal girth, and purple striae, you can think of Cushing syndrome. So if you are enjoying this content so far, please be sure to put up the like button, hit subscribe, and the notification bell so that you never miss another video like this. And it also lets me know that you like this type of content so I can make even more. So what is the most likely cause of this finding? So this image is showing you late decelerations, which is most commonly due to uteroplacental insufficiency. Why is sodium bicarbonate used in salicylate and TCA toxicity? So the same drug is used in 2 different conditions for 2 completely different reasons. So sodium bicarbonate is given in salicylate toxicity because it can alkalinize the urine, while in TCA toxicity, sodium bicarb is used because it stabilizes the cardiac cell membrane. It's very important that you remember these key differences. What is the most likely cause of bilateral leg edema that does not respond to diuretics? Lymphedema and chronic venous insufficiency. What is the first line of treatment of a 33-year-old African American female that has a cough, bilateral hilar adenopathy, and hypercalcemia? Glucocorticoid therapy, because this patient has sarcoidosis. A patient being treated for osteoporosis develops dysphagia. What other agents can also cause this condition? Ferrous sulfates, NSAIDs, potassium chloride, and tetracyclines. So in a patient being treated for osteoporosis, they could be getting bisphosphonates, which causes patients to develop pill-induced esophagitis. So this question requires you to know that and be able to relate it to other agents or medications that can also cause pill-induced esophagitis. What is the treatment of choice of a patient that presents with a vaginal discharge due to a motile protozoa? Metronidazole, which is the treatment for trichomonas. So what if the question asks, what is the treatment of choice in a patient that presents with a vaginal discharge due to pseudohyphae? That would be fluconazole. What is the most likely diagnosis of a patient with hypertension, hirsutism, and easy bruising? Cushing's syndrome. What antihypertensive should be avoided in a patient with a history of gout? Thiazides. So if a patient is taking an antihypertensive and then they develop this swollen, painful toe, think of thiazides being the cause. What endocrine adverse effect can niacin, hydrochlorothiazide, corticosteroids, and protease inhibitors cause? Hyperglycemia. What hypertensive decreases the risk of nephrolithiasis? Thiazides. What antihypertensive should be avoided in a patient who is pre-diabetic? Thiazides. So as you can see here, I'm really trying to emphasize the importance of knowing and mastering antihypertensive medications and knowing that if a patient is on an antihypertensive, you can then find out any possible side effects or adverse effects that may result due to them taking this medication. What process may occur after a girl is at Tanner stage 3? Menarche. What organism is the most likely cause of watery diarrhea of a daycare worker? Rotavirus, especially in the winter. What is the most common cause of pink eye? Adenovirus. So remember that pink eye is really viral conjunctivitis, which is most commonly due to adenovirus. Okay, true or false? Pregnant women can receive the intranasal influenza vaccine. False. Remember that the intranasal influenza vaccine is a live vaccine, which is contraindicated in pregnant and immunocompromised patients. What autoimmune disorder can cause non-pitting leg edema? Hypothyroidism. Recall that there is mixed edema that can be seen in patients with hypothyroidism. And also, bonus question, what drugs can cause hypothyroidism? If you said amiodarone and lithium, then you are absolutely correct. Oral contraceptive pills decrease the risk of which gynecological cancers? Ovarian and endometrial cancers. What adverse effect may result if aspirin is used with ginkgo biloba. And hopefully I pronounced that correctly. But the answer is excess bleeding. And if you want to see more rapid review videos for the family medicine shelf, then please be sure to check out this video right here. And if you enjoyed this video, please ensure that you power up the like button, hit subscribe, and that notification bell so that you never miss another video like this. Thank you so much for watching. Goodbye.